Hello dear students, welcome back to my channel Hello Pharmacology. In today's session, let us continue with the actions of muscarinic receptors. So as we know, what is the prototype drug that acts on muscarinic receptors? That is acetylcholine is a prototype drug. So please remember, so in this class we are mainly concentrating on the muscarinic actions on. So mainly we are concentrating the muscarinic actions on smooth muscles. So which is the receptor which mediates the action through smooth muscles? It is, please remember, it is M3 receptors. So basically it will going to increase the tone of the smooth muscles, and also it will going to increase the contraction. So let us take one by one. So what are the muscarinic mediated smooth muscles action? So basically first we'll take gastrointestinal tract. So gastrointestinal tract. So what happens in the gastrointestinal tract? So basically in the gastrointestinal tract, there will be increase in the tone. There will be increased peristalsis, and at the same time there will be a relaxation. So please remember, there will be relaxation of what? Sphincter muscles. So altogether this will lead to abdominal cramps, and it will help in bowel evacuation. So next we'll moving on to the what is the receptor mediated smooth muscle action in the ureter and the bladder. So in the ureter and bladder. So let us draw a diagram for understanding it better. So if this is the ureter, this is a simple diagram. You can also write in exams to score better marks. So you need not to be a good diagram writer. Just if you could able to manage with a simple diagram, that would be fine. So let us see what is happening here. So there will be increased in the peristalsis where the ureter. So what is happening with respect to the detrusor muscle as well as the trigone of bladder and the sphincter in the bladder? Let us see. So here you have a detrusor muscle. Here you have a trigon, that is, it is a bladder trigon, and you have a sphincter here. Sphincter. So what is happening with respect to the muscular mediated action here? So on activation of which receptor here? So please remember, it is again the M3 receptors. So what is happening on activation of M3 receptor? Retrosor muscles will contract. Whereas the bladder trigon and sphincter will going to relax. So altogether it will help in voiding of bladder. So next, let us see what happens when you administer a cholinergic agent in a patient who is having bronchial asthma. So what is the effect on bronchial smooth muscles? Bronchial muscles. So as you can see, you can write a simple diagram again here. So you can show it as a bronchus and you can show it as a lung. Okay. So again here in the bronchus you have got M3. So what is happening once you give a acetylcholine, which is a prototype drug? This acetylcholine will going to activate the M3 receptors and further it will lead to bronchoconstriction. So please remember, it will lead to contraction of bronchial smooth muscles. So once there is a contraction of bronchial smooth muscles, there will be bronchospasm. There can be dyspnea, difficulty in breathing. At some times it will going to precipitate bronchial asthma in sensitive individuals. So basically what will happen is, so this is the normal diagram. If you see the bronchus here, so what is happening after M3 activation? It will going to constrict. So pipe will become very narrow. So to summarize, so in the smooth muscles, you need to remember the actions mediated by acetylcholine using the muscarinic receptor, in particularly M3 receptor. So you have got the GIT. In the GIT, please remember, so there is a increased peristalsis, and also there will be increased tone, but there will be relaxation of sphincter. So altogether it will going to cause abdominal cramps and bowel evacuation. So on the other hand, when we come to ureter, and the bladder. So this is the ureter. So again here it will be increased peristalsis. Here you can see there is a detrusor muscle. So this will be contracted, or contraction occurs in the bladder, trigone, as well as the sphincter. What happens is the relaxation. So altogether this will going to help in voiding and in the bronchus, in the lungs. So if you are activating the M3 receptor, there will be bronchospasm, mainly due to the contraction of the bronchial smooth muscles. Contraction of bronchial smooth muscles. So you should be careful, it may precipitate bronchial asthma. It may precipitate attacks of bronchial asthma. So this was about the action of muscarinic receptor by the acetylcholine. That means to say acetylcholine mediated actions through M3 receptors on smooth muscles. Thank you.
Thank you.